Will's Chiropractic today on another beautiful Wednesday. The weather's not quite as nice as it has been, but hopefully it'll be changing this afternoon. Last month, talked all about posture, ergonomics, sitting, tech neck, all those types of things. This month I want to change gears a little bit, but kind of dovetailing off what we talked about last week. And we're going to be talking about inflammation and injuries this entire month. Obviously, one of the biggest reasons we're talking about that is now that we're in June and July and August, everybody has their yard work they have to do, the projects they want to do, the little shed they want to build out back, whatever it may be. But we see a ton of injuries during the summer from people doing things they're just not used to doing. So I want to go over just two things today. Number one, I want to go over kind of some of the most common injuries that we see and kind of how to avoid them. And number two is how your body responds to injury and the inflammatory response, because most people have a not real grasp of kind of how that works and how that helps your body heal. So let's talk about injuries first. So obviously, being a chiropractic office, we're going to see a lot of spinal injuries, whether it's neck or back injuries. We also see a lot of shoulder injuries, elbows, knees, hips, even ankle injuries as well. So let's just start with the most common injury we see, which is a low back injury. Now, we tend to see a lot of these during the summer in particular because people are out doing yard work. Now, the joints in your low back are kind of orientated like this. So we can bend forward and backward and deadlift a house and not really going to hurt your low back. The problem is when we add a little bit of, we bend forward and we add a little bit of rotation to it. And if any of you hurt your low back, you're probably thinking right now, yep, that's exactly how I hurt it. So some people come in here with just tying their shoe. They bend down to tie their shoe and hurt their low back, or picking up a thing of laundry. It's not the weight so much as is the motion. Now, 99% of the time, you can bend like this and twist, and it's no big deal. But that 1% of the time, you shear the joint surfaces together and end up spraining the joint. It's kind of like spraining the ankle, only it's in your low back. We get the same thing up in the neck. A lot of people do a lot of shoveling and digging they're not used to doing. We talked about tech neck ad nauseum last month. So you lose the curve in your neck's all shoved forward, and now you're digging in the dirt. It's probably pretty dry and pretty hard. You pull up, and that big muscle that covers your back, called the latissimus dorsi muscle, is very, very powerful and actually tug really hard on your neck, causing a lot of problems up there as well. We see a lot of joint sprains, obviously ankle sprains during the summer, just people out hiking, stepping on a rock, rolling their ankle, things like that. Now, what happens when you injure an area is it triggers your body's inflammatory response. And the inflammatory response is absolutely critical in getting the body to heal as quickly as possible. So what happens is, in that area, let's say you sprained your ankle, okay? So all the blood vessels in your ankle are going to swell up a little bit and become leaky so that you can get all the plasma proteins and platelets and white blood cells and all the good juice to that joint, that damaged tissue, to stimulate the healing process and get it to do what it's supposed to do. So the inflammatory process, you have kind of 5 key things to give you an idea of what that is. The area will probably turn red, it'll be hot, it'll be painful, it'll be swollen, and you'll probably lose function in the area. You won't be able to really move it very well. Now, the reason that the loss of function and the pain is so huge is because your body doesn't want you to move that area. So if you've damaged a joint or damaged tissue, your body doesn't want you to move that area. It wants you to kind of keep it kind of stable so it can do the healing and do what it's supposed to do. So an acute inflammatory response, if you sprain an ankle or sprain your back, should last maybe 2 or 3 days, and that's it. If you're having inflammation lasting longer than that, it's starting to drift into chronic inflammation, which can last up to weeks to months to even years. Chronic inflammation is a whole different ballgame because chronic inflammation actually kills the tissue in there. It kills the tissue, it thickens and strengthens scar tissue formation in there, adhesions and those types of things. So anybody with frozen shoulder out there, you kind of understand this. You damage your shoulder, it becomes inflamed, it never really gets fixed up, and the inflammation just keeps building and building and building, and all of a sudden, instead of being able to move your arm all the way up, pretty soon you can only move it about this high, and then this high, and then pretty soon that shoulder's frozen, and now you can't move it at all. All right, so chronic inflammation is really, really bad. And we see chronic inflammation a lot in patients that have had injuries that either never healed up the way they were supposed to, so every time they move now, they're just kind of grinding and re-inflaming the area over and over again, or they keep doing the same motions over and over and over and over again and damaging the area, like repetitive motion problems. Last month we talked about postural changes. Posture is kind of a repetitive motion problem, and the worse your posture gets, the more damage they're done to the joints. All right. So the only way to combat that is to actually correct the function of the joint, correct the mobility of the joint. That's what we do as chiropractors, is restore function, restore mobility to joints in your spine, in your elbow, your hip, your knee, wherever that may be, and allow your body to be able to heal. If you're finding yourself having the same problems over and over and over, you know, that back pain that won't heal, the shoulder that won't heal, the knee that won't heal, most likely it's because there's some kind of joint dysfunction, some kind of nerve dysfunction, not allowing the body to heal up, and you're starting to get a chronic inflammatory response in there that's basically destroying that tissue. Now, the other problem we see with chronic inflammation is one of the ways to treat inflammation is through either over-the-counter like NSAIDs, whether it be naproxen or ibuprofen, Advil, aspirin, those types of things. They kind of artificially lower that inflammatory response. If it gets bad enough, we even see people getting cortisone shots. Now, cortisone shots and the naproxen, all these different drugs don't fix the problem. They just decrease the inflammation and pain. Now, the issue with that is if my back no longer hurts, even though I still sprained it 2 days ago, now all of a sudden my body can't tell me, hey buddy, don't do this motion because you can't feel it. There's no pain, there's no inflammatory response anymore. So I'm not saying that these drugs are bad, I'm just saying they're not a fix. And we have too many people out there that think, well, I got a cortisone shot, I'm fine. Well, if I get a cortisone shot in my shoulder and I have a torn rotator cuff, it doesn't matter. That shot doesn't fix the torn rotator cuff. It's still bad. So even though you can't feel it, you're still doing more and more damage to the area, which causes other issues with the joint, with the cartilage, with the ligaments and tendons. And unfortunately, that's what we see a lot in our office is patients that have come in, gotten cortisone shot after cortisone shot in their back or their neck, and now the joints are completely trashed. The tissue around there is completely destroyed and changed forever, and now we have to dig out of a pretty big hole. So if you're finding yourself having the same issues over and over again, if you're finding yourself continually hurting your back every time you do this, you probably need to see us and make sure that the body is functioning the way it's supposed to, that joint is functioning the way it's supposed to. Otherwise, you're going to end up, like unfortunately a few patients we've had here recently, where the pain is insurmountable now, and we're kind of forced with just surgery down the boat. And surgery is kind of a 50-50 proposition. Sometimes it works very well, other times not so much. So that's kind of the introduction to the inflammation and kind of the injury process in there. Again, if the one big takeaway here is when you lift things, obviously we want to use our legs, but I know that people aren't going to do that. Sometimes you're in a hurry. But if you bend straight forward and straight backwards, you're much better off than doing this rotation thing. That's when most people usually get hurt. Obviously warming up, stretching, those types of things also help as well. But the biggest thing is making sure you're using proper biomechanics when you're picking things up so you're not injuring yourself over and over again. Tomorrow we're going to talk about some foods that actually either make you pro-inflammatory, which makes your inflammation response even bigger, which is not very good, or deflammatory, so actually it decreases the inflammation in your body. And we'll talk about those next time, or actually tomorrow. Next week I'm going to talk a lot more about pain and kind of how pain is a good thing, kind of lets us know what's going on, and then we'll kind of build from there. So hopefully you got some value from this. I know injuries and how to take care of them are a big question mark for a lot of people. We're going to be going over a lot of information this month on how to take care of injuries, what you need to do, the do's, the don'ts. There's a lot of misinformation out there. So if you have questions, make sure you put them in the comments below so I can make sure that I answer them, because people will come in here all the time with injuries that they just don't know how to take care of them. They end up making them worse instead of better. So hope you guys have a great day, and until next time, keep living the dream.